Hello and welcome. I'm Dr. Jim Lewis, founder of the Brain Injury Education Project. Thank you for making the decision to learn more about how brain injuries, known as neurotraumas, are happening in substance use disorders. Just as important is your willingness to follow up this video with the professionals that are helping you. You will be hearing about specific decisions that you can make to help improve brain healing and to prevent any worsening of your brain-related symptoms. This program and the first video that you saw on neurotrauma and domestic violence are all supported by a grant from the Federal Bureau of Justice Assistance through the Pasco County, Florida Adult Drug Court. So, who is this program intended for? Primarily, it was developed for women in the Pasco County Adult Drug Court program, but it's really for any woman who has experienced struggles with domestic violence or alcohol or substance abuse. It is also for the professionals who work with these women, professionals in substance abuse counseling, therapists, attorneys, judges, and domestic violence advocates. So what are we going to do in this video? We're going to cover what exactly is neurotrauma in substance use disorders. We're going to see how neurotraumas of concussion and hypoxia, which are in domestic violence as well, and you already learned that, are different in how they occur in substance use disorders, which we will refer to as SUDs. We'll give examples of symptoms that neurotrauma can cause, and we'll learn about life choices that you can make that will promote the best chance for your brain healing and recovery. By necessity, this video does have some graphic images that show facial, head and neck injuries in substance use disorder involved persons. Any videos that are of actual individuals are from public records, so there was no privacy or confidentiality issues. So let's just briefly review what you already learned about neurotrauma and domestic violence. You learned that those concussions and hypoxias are inflicted deliberately by an abusive partner. And again, there's two types. Neurotrauma from concussion, they're primarily from blows to the head, but it could also be, as you recall, you're being pushed or slammed and your head is striking against a wall or down on a floor or downstairs and so forth. And you learned from the domestic violence video that hypoxia occurs. It's a disruption of oxygen supply to the brain. In DV, those are mainly inflicted from strangulation or smothering, and every once in a while from someone intentionally trying to drown you holding your head underwater. So that's quite different from what's happening in substance use disorders. What's the connection between DV and SUDs? Why do we look at these two things together? Why are we looking at them together for women in the Pasco County Adult Drug Court? Well, the first possibility is someone already has addiction issues. You're already using, but you haven't been involved in domestic violence. You then meet a romantic partner who often is also using, but not necessarily. In any case, that partner then becomes abusive to you. And at that point, your substance use increases to cope with this. The other possibility is that you could have little or no history of alcohol or substance disorder. You meet a partner who becomes abusive, and then you begin to rely on alcohol and substances to cope with the trauma from your DV. The important thing to understand is because both domestic violence and SUDs produce repetitive neurotrauma events, these magnify one another. So that's why we have to look at them together. So how are the neurotraumas and SUDs different from the concussions and hypoxia, cutting off oxygen to the brain? How are they different from what occurs in domestic violence? On domestic violence, we saw they're inflicted intentionally by an abusive partner. In SUDs, these are accidents. So someone is intoxicated under the influence, trying to drive a car, a motor vehicle. You don't have the coordination. There's impulse control issues. Your reflexes are poor, and you stumble and fall. So you have fights, falls, and motor vehicle accidents. Those are the three primary causes of concussion in SUDs. How does hypoxia occur in SUDs? It occurs from a specific type of event, overdose-related respiratory, and cardiac arrest. And we're going to look at both of those again in a second. So let's get back to concussion first. Just a single blow to the head can cause the brain to shake rapidly, almost imperceptibly, 30 times per second. And here's another view of that. The pink in this image is the brain, and the blue is fluid that surrounds the brain. So there's usually enough fluid there to cushion the brain in a mild fall or a mild blow. Not every time someone has a fall, they're going to have a concussion. Why are concussion falls more commonplace in substance disorders? Because when you're falling and you're under the influence, your reflexes aren't working as well, and you don't break your fall. So you're more likely to get concussed in a fall when you're under the influence. These next two are some stock images showing facial injuries. These are actual, published photos of individuals that were in a kind of nightclub. It could be any kind of, a bar, a drug party, whatever. So what I want you to understand a couple of things about this. And here's the other image. So why are these two images important? So first of all, a blow to the face, however this person was hit, it could have been a punch, it could have been somebody hitting them in the face with a chair or bar stool or whatever, baseball bat, whatever. A blow to the face that is of sufficient force to cause these lacerations to the face and the mouth, those forces are sufficient to concuss the brain, because what's on the other side of the facial bones? The brain is shaking within the skull. The other thing I wanted you to pay attention to, these are young people. So substance abuse disorder, concussion, and hypoxic can occur with any age, but it's more common in the late teens, early 20s, and 30s. Yes, there are women in their 40s, 50s, and 60s that are getting these injuries, but these are very common in the younger 18, 20, 25, 30. We haven't looked at teenagers yet, but I'm sure it's happening there. Why is that so important? Because you want to get the earliest treatment possible to prevent these from becoming repetitive at the youngest age possible. So what are some examples of symptoms that you get in these substance-related fights, falls, and motor vehicle accidents? At the instant of impact, you feel dazed, dizzy, woozy, stunned. Some people report, I saw stars for a second. A couple of minutes later, hour later or so, you might feel nausea or blurry or double vision. Hours later the same day, sometimes days and even weeks or months later, you can have this feeling of brain fog. Some people call it cobwebs, where you're just not sharp and your sharpness isn't returning. And these are more common if in the case of not a single injury, but these repetitive injuries that are occurring. And lastly, you can notice considerable difficulty with your short-term memory. You might remember things from 5 or 10 or 20 years ago, but not from a few hours or a day ago. And there's something also on the bottom of this slide called rapid mental fatigue. What does that mean? It means it's something that normally you could do for 20, 30, 40 minutes an hour before you start to get mentally fatigued. Now, with these concussive repetitive injuries, you could get mentally fatigued in a few minutes. And all of a sudden, you can't do the task anymore. What's happening to me? And lastly, you can have symptoms that start to look like what's called adult ADHD. But adult attention disorder came from childhood developmental attention disorder. This is different. This is acquired attention disorder that is acquired from multiple repetitive concussions. So now we're going to turn to the other type of issue that can occur in neurotrauma in substance disorders, hypoxia. Why is it so important to understand this? So the brain, the weight of the brain, the size, the mass of the brain is only about 2% of the entire body size. However, the brain is an incredible oxygen consumer. It's consuming at any given moment. 20% of the oxygen we take into our body is going to the brain. So you can imagine from that, when we become oxygen deprived for any reason, the brain suffers the most. The other thing to understand is that the whole brain isn't affected equally by oxygen deprivation. The parts of the brain where the cells fire very rapidly are the ones that are more affected because they have a higher oxygen demand. What are some of those areas? The areas of the brain that control or it's called mediate short-term immediate memory. So that's why people who have had overdose events notice short-term memory is very impaired and can be even more impaired if you have more than one event. So what is this statistic here? It's not surprising that somebody who's in a hospital could be a risk of having cardiac arrest. People there for heart surgery, they're having other kind of surgery, something goes wrong, they could have a momentary cardiac arrest. Some of these are fatal, but we're talking about those that are not fatal. Outside of a hospital, there are more cardiac arrests in the United States occurring outside of hospitals from drug overdose than from any medical condition, And this study was published in 2019. It's even more in 2020 and even more in 2021. So this issue is getting worse. What causes overdose cardiac arrest? There's a misunderstanding, even in the professional community, that it's all opioids. And that's true, it is opioids, but it's not only that. What are opioids? Fentanyl, oxycodone, prescription narcotics, heroin laced with fentanyl, whatever. And why is that? Because things like alcohol and opioids, they depress or suppress how you're breathing. They suppress or depress the functioning of the heart and the respiratory system. So opioids are more well known for causing cardiac arrest, but, and there's an epidemic of this in the United States and really in the whole world, methamphetamine, cocaine, crystal methamphetamine, and other things called psychostimulants. They cause cardiac arrest in a completely different way. Your heart is beating so fast, the muscle gets tired, and you can go into cardiac or respiratory arrest. So what are some of the things to understand about the dangers of substance disorder, concussion, and overdose events? Well, first, again, it's not from a single concussion, but repetitive concussion. So if you are actively using and you're under the influence of alcohol or substances, you have a higher risk. Some people have published it's 80 or 90% of the time you're at risk for fights, falls, motor vehicle accident, concussion. Overdose events, it takes very few to cause significant neurotrauma. 1 or 2 overdose events. Some people have had 5, 10, 15 of these. And so the hypoxia, the lack of oxygen to the brain, is extremely dangerous. And again, it can leave lasting deficits in short-term memory. So what is the answer? What do you do with all this information? What are some things that you can put into place to try to change the possibility that you're going to be at risk for these in the future? We are stuck, professionals, and you are stuck with what's already happened. We can't change that, but you can change what can happen in the future. So again, it's these 2 crucial life-changing decisions. One is committing to total alcohol and substance abuse abstinence. Now, there's substance treatment programs that focus only on that. Because we're seeing people with substance disorders are also experiencing domestic violence, just quitting alcohol and drugs, even though that's a great achievement, it's not enough. Because imagine you become abstinent, you leave your program or your outpatient program or your residential, you go back out on the street or wherever you're living, and you're still in a domestic violence relationship. You're going to be at risk for more concussions and hypoxia from inflicted injury. So those 2 things have to happen simultaneously. They have to be 2 concurrent goals: no alcohol or drugs, quitting all abusive relationships. If you do those 2 things together and you sustain that, it decreases the risk of 2 things. First of all, that your brain's not going to get worse from additional neurotraumas. And secondly, you give the brain a chance to heal. So my last recommendation is that after just thinking about these 2 crucial life-changing decisions, discuss this video with your counselors. If you're at WestCare, in individual or group discussions, with your mental health advocate, with your domestic violence advocate, crucial things to do. So there are other videos that we have. To be sure that you have access to all the current and future videos that we're producing in the Brain Injury Education Project. You'll see a subscribe button on the screen. Click on that to make sure you're subscribed. And I thank you in advance for sharing these valuable links with others. I have a couple of thank yous. First of all, to the WestCare Foundation staff, the Circuit Court in the 6th Circuit of Florida that's helped with this program. And my thanks to Lauren for helping do this recording. So we'll see you at the next video. Take care.